Morning, guys. We are live today. We're talking skincare at the Colorado Springs Dermatology Clinic. On the way, we're talking with the doctors, the experts, about psoriasis and how this skin treatment here might affect your joints and a lot more you might not realize. That is coming up in just a little while. Hang on.
You're watching Fox 21 Morning News.
That's right. We're talking about psoriasis coming up here next. Get you turned on, doesn't it, Doc? Yeah. It does. On the way, we'll talk about how our location and lifestyle helps fight against this disease. That is coming up next.
It is now 6:28. Proper skin care can go a long way in helping us look and feel better.
Craig Coffey at the Colorado Springs Dermatology Clinic this morning with more on keeping our bodies happy and healthy. Good morning, Craig.
Learning some good stuff. That's right. Kimberly and Justin, good morning to you. Do you ever feel like you're not the smartest guy in the room? Has that ever happened to you? Today is my day for sure. Good morning to you. This is Dr. Sperber, MD, PhD. I do not want to play trivia with you because you know your stuff. Okay, we're here talking about skincare all day long. Let's first of all talk about the clinic right now because you really there's a lot offered for a lot of different, I guess, treatments under one roof.
That's right. That's right. We have 7 board-certified dermatologists in our group. We have satellite offices in Pueblo and in Canyon City, and our main office is here in Colorado Springs.
Okay. I would imagine in our area, of course, with our exposure to sunlight, the altitude, dermatology is a pretty good field to be in this area.
It is. It is. We see a broad range of diseases. Every one of us in this clinic sees acne, warts, eczema.
Right.
But then with our size, we're able to see more specialized things each individually as well. We have areas of expertise, per se.
Okay. I know that your area of expertise is psoriasis, right?
That's correct.
What exactly is psoriasis?
Good question. Well, psoriasis is an autoimmune disease.
Okay.
So where normally your immune system would attack bacteria, viruses, bad guys, in this instance, in psoriasis, it can affect your skin. It will attack your skin, and not only your skin, but it can also affect your joints, and we've learned recently in the last 10 years or so that it can also increase your risk of internal problems like heart attacks,
That's
stroke.
interesting that a skin disease that you think is, external affects a lot of internal things going on.
Exactly.
Okay. So with psoriasis now, we learned earlier when it comes to skin cancer that our elevation, exposure to sunlight so much during the year increases our risk for skin cancer. But now you're saying here that because of where we live and also our lifestyle here in Colorado, that actually helps with those fighting psoriasis.
It absolutely can. Normally the incidence of psoriasis is about 2%. Maybe 4%. In Colorado, it's a little bit lower. We have a very active lifestyle. We're out and about skiing, hiking, and we're also at a higher elevation. Being outside in that sunlight, the sun is a little bit immunosuppressive, which we'll talk a little bit more about next segment, correct?
Okay. Yeah, coming up next, we're going to talk about how to treat psoriasis. Photolight therapy is a big option. Also, the lasers, right?
Exactly.
You want to do that. You know you do, Doc. Lasers. Okay, that's on the way next here. Some good stuff. It's good to know in case you or someone you know, a loved one too, might have this disease, psoriasis. We'll talk about that coming up. Back to you.
All right, pretty common thing too. So thanks so much. We'll look forward to that, Craig.
Good morning, guys. That's right. We're here this morning talking about skincare, like you said, at the Colorado Springs Dermatology Clinic. On the way, this is Dr. Sperber. We're talking psoriasis, this genetic predisposition disease. Also ways you can fight this too. That's coming up next. Hang on.
6:46 is your time. Living here in Colorado, we know how our skin can be affected by things like changing temperature, altitude, sun exposure, and of course the dryness.
Yeah, always just so dry here
Yeah.
in my hands. I'm constantly trying to apply lotion. Craig Coffey this morning, he is with the experts talking about what you should do, the Colorado Springs Dermatology Clinic, and about this concern that has a lot of us all chapped. Good morning, Craig.
Justin, my dry friend, good morning to you. Check this out. Here is a gift box from the dermatology.
Oh, bring it
clinic
over.
right there.
Yeah, I want to see
An
that.
assortment of creams and skincare lotions, yes?
Are there any salves?
to
Are there
you.
salves?
Salves? Are they
Yes.
salve?
Yes,
Is that
salve.
right? Salve? Yes. Okay. Thanks a lot. We're learning so much. By the way, where we live really affects our skin in dramatic ways, positively and negatively. We're talking psoriasis right now. This is Dr. Sperber once again. Good morning.
Good morning.
MD, PhD, big brain. All right?
I don't know about that.
Okay. Let's talk psoriasis. This is a genetic predisposition, right?
Exactly. So
Okay.
you can inherit the potential to get the disease.
Okay.
But then as life goes on, you need some environmental trigger that's going to set it in motion.
Okay, it's not contagious.
Not something that's contagious.
Okay, but it's just something inside that can be triggered at any point in our life.
Exactly.
Does it happen more in children or in adults?
Probably average age about 20 or 30.
Okay.
But definitely young infants can develop the
Right.
disease, and we have some elderly people who've never had the disease and show up in their 70s.
And again, psoriasis, this, I didn't realize this, the impact it has. It's a skin disease, but it can affect things internally inside.
Absolutely, absolutely. Not only can it affect your joints, it can increase your risk of heart attack, stroke, diabetes, and the psychosocial or the psychological impact can be enormous.
Okay, let's talk about treatment now for psoriasis, different options. We have photolight or light therapy.
Exactly.
Right behind us, okay.
Exactly. We have creams, we have pills, we have shots that you can give yourself, all kind of designed to quiet the immune system. The light here is a nice alternative. It might look like a tanning bed,
Right.
but it actually is not. These are special bulbs that have a very narrow wavelength of light that are affecting a cell in the top layer of the skin called the dendritic cell, and that quiets down the immune system at the
Okay.
surface of the skin.
Okay, so the light then will help kind of subside the, I guess, effects.
The skin disease,
The
exactly.
skin disease, okay.
Exactly.
So it's still there, it doesn't knock it out.
Nope, nope, you're not going
Okay.
to cure this disease. This is there to control the disease.
And quickly here we have a laser. This is the laser, by the way.
Yeah, so we are one of 3 clinics in this state to have this laser. It's exactly the same wavelength of light, but
Right.
it's focused down into one pulse of light.
Okay.
And patients will come in and get this treatment twice a week.
Okay, it doesn't take long either to do, does it?
No, just minutes.
Just minutes, okay. You can't expose yourself too long to this light as well.
Well, believe it or not, with this ultraviolet light, the risk of skin cancer is minimal, if any,
Okay.
as compared to a regular tanning bed or going outside. So that's why we
Interesting.
use this in the clinic. It's
Okay.
perfectly safe.
Dr. Sperber, thank you so much. We're going to have more coming up here again this morning from the Colorado Springs Dermatology Clinic, talking skincare all morning long. That's it for now. Back to you guys in studio.
All right, I want to try some of those creams.
Yeah.
I'm always looking for new and improved,
Salves.
whatever, something
Yeah.
for my skin. All
Got
right,
it.
thanks so much, Craig.